Hello guys, good afternoon. This is Professor Henderson and today I'm coming to you with another video on NCLEX style questions. So these questions are meant to mimic NCLEX style and these questions were actually formulated using the medical surgical book Potter and Perry 2017. So if you like these videos, please consider subscribing to my YouTube channel, like, share, and comment. I always post videos on maybe twice a week or so. So these videos can help you to deepen your understanding and help you to prepare you to take nursing exams. So please like, share, and subscribe. Thank you. So the first question I have here: a patient with ventricular tachycardia at 200 beats per minute and multiple PVCs, premature ventricular contractions, loses consciousness. What treatment is most common in this situation? A. Emergency defibrillator. B. Digoxin. C. Proketamide. D. Lopressor. So the correct answer will be this patient is in VTAC, and VTAC could be stable or it could be unstable. So as you can see, this patient is demonstrating all the symptoms of being unstable, such as decrease in cardiac output because they lost consciousness. So the correct answer will be emergency defibrillator. The second question I have: a college-age student has influenza. At what stage of the infection is the student most infectious? A. Prothrombal. B. Incubation. C. Convalescent. D. Illness. The correct answer for this question is A, as in alpha. Question 3. On the morning assessment, patient in room 225 who has third-degree burn. You observe fluid starts to accumulate in his abdominal tissue. You notice his weight has not changed and his INO, input and output, is equal. What do you suspect? A. Third spacing. B. This is a normal in burn clients. Document your findings. D. Compartment syndrome. So the correct answer is A. Third spacing. The next question: the nurse is preparing to administer an IM injection to a 6-month-old infant. So this is an infant here. Which injection site is most appropriate for this patient? A. Deltoid. B. Dorsogluteal injection site. C. Vastus lateralis. D. Abdomen 2 inches away from the umbilicus. The correct answer is C. Vastus lateralis. This is the most common site to give an IM injection for an infant. A parent called the school nurse with questions regarding the recent school vision screening. Snellen chart examination revealed 20/60 for both eyes. Which response by the nurse is the best regarding the eye examination? A. Your child needs to see an ophthalmologist. B. Your child is suffering from strabismus. C. Your child may have presbyopia. D. Your child has cataract. So the correct answer is A. Your child needs to be seen by an ophthalmologist because the normal vision is 20/20. A febrile preschool age child presents to the after-hour clinic. Varicella chickenpox is diagnosed. On the basis of this illness, history and presence of small circumscribed skin lesions filled with serous fluids. What type of skin lesions will the nurse report? A. Vesicle. B. Wheal. C. Papules. D. Pustules. The correct answer is A. Vesicles, because vesicles are very, very indicative of chickenpox. So the correct answer will be A, as in alpha. So the next question I have here is, the nurse manager is evaluating current infection control data for the intensive care unit. The nurse compares the past patient data with current data to look for trends. The nurse manager examines the infection chain for possible solutions. In which order will the nurse arrange the items for the infection chain, beginning with the first step? So we know D is the correct answer because it always starts with the number two, an infectious agent or a pathogen. So we know an infectious agent can be a virus, could be a bacteria, it could be a protozoa. So it always starts with an infectious agent. Then for a reservoir. Reservoir is where the microorganism lives and grow and survive. Then the third link is portal of exit. How does the microorganism exits the body? One is the mode of transmission. So it could be direct mode or indirect mode. And 5 is the port of entry to a host, how the microorganism enters the body. So the correct answer will be D, as in David. The next question I have here, the nurse is caring for an older adult patient and notes that the temperature is 98.6, 36 centigrade. How will the nurse interpret this finding? The patient has hypothermia, the patient has normal temperature, the patient suffering from hypothermia, or the patient demonstrates increase in metabolic rate. So the correct answer is B. The patient has a normal temperature because 98.6 for a geriatric client is very normal. This question, which of the following order would the nurse question? So which of these following orders will the nurse question? So the correct answer in this question will be D, administer 8 liters of oxygen through a nasal cannula. Because you administer that oxygen, you can put the patient into what? Oxygen toxicity. So we don't administer 8 liters of oxygen through a nasal cannula. That is not what we do as nurses. So the nurse definitely will question this order, 8 liters. The next question I have, a client exhibits the following symptoms: tachycardia, increased thirst, headache, decrease in urine output, and increase in body temperature. After analyzing these data, the nurse assigns which of the following nursing diagnoses. So as we know, the patient is at risk for fluid volume deficit related to all these symptoms that they are exhibiting. So definitely they have decrease in fluid volume deficit. So C is the correct answer for that question. The nurse is caring for a patient who is having difficulty understanding written spoken words. The nurse suspects the patient has A, expressive, B, receptive, C, Volkers, D, Wernicke's. So the patient is having expressive aphasia. B is the correct answer for this question. The nurse receives handoff report on 4 patients. Which patient should the nurse assess first? So now this is a priority question. The patient with right leg pain, rating 8 out of 10, asking for pain medications. B, the patient with a pulse of 42 beats per minute. C, the patient has a blood pressure of 102/62. D, the patient with respiratory rate of 18. All these are within normal limits, all of these. So the one that the nurse is going to take priority over is a heart rate of 42 because this patient is in bradycardia. So that takes precedent over the other ones. So B is the correct answer for that question. A patient is recovering from surgery. The patient is very restless. Heart rate is 120 beats per minute and blood pressure is 70/53. Skin is cool and clammy. As the nurse, you would A. Continue to monitor, notify the MD, obtain an EKG, check the patient blood glucose. So as you can see, the patient's recovering from surgery, so they might be having complications, and they're demonstrating all the symptoms of decrease in cardiac output. So maybe the patient is going into cardiogenic shock. So you will have to notify the doctor, and he'll give you further instructions. Start IV fluids. Maybe they're going to put the patient on some medications to increase their blood pressure, so on and so forth. So B is the correct answer for that question. Next question. As a nurse, you are getting the patient ready for surgery. You are completing the preoperative checklist. Which of the following is not a part of the preoperative checklist? Assess for allergies, conduct the timeout, informed consent is signed, ensuring that the history and physical examination has been completed. So the correct answer will be D. This should be done way ahead, not the time of surgery. So D is the correct answer. That's the one that you should question. D. It's not a part of the preoperative checklist. So guys, this is all for this video. Thank you so much for watching this video, and thank you so much for your time and your cooperation. And again, please continue to like and share these videos and subscribe to my YouTube channel. I post educational videos maybe about twice a week. So if you're in a nursing program and you're trying to become an LPN or RN, these videos can really help you, can help to deepen your understanding and kind of help you to how to answer, to think a little bit outside the box and how to answer NCLEX style questions. Thank you so much for watching, and bye for now.